all my Cushing disease angels out there in the world, if you know someone that has been suffering with different medical problems, instead of them just sitting around, they need to just educate themselves more about their medications, as well as the service that they're receiving from the doctors that they have. They have to be more concerned about themselves in life itself. If not, then things start falling apart. Some things that will never change. And one thing about it is that we can't erase the illness that's going on in our body, but we can't control the outcome of the suffering. We can control our emotions and how we feel, and think more positive and smile, even though when we don't even feel well. Well, a while back, I was several years ago, I had a bad experience with a horrible nurse practitioner. I'm not going to call her name, but she was very rude, and she had a little prejudice in her. And it may not, if she didn't have it, that's what it came out to be out of her mouth. And she may not have the intentions, but it left a bad mark on me. So I had this thing, I don't want to deal with nurse practitioners. It's nothing but horrible experiences. But I did find one good one. Her name is Cindy Polk at UT Southwest Medical Center. Come to find out, she said, I only met you once with the doctor, and I never seen you again. She said, I heard about your experience, and I said, well, I decided to give it another chance. I couldn't remember if it was your name or her name. And then she said, yeah, no, it wasn't me, because I had just started. But I had a great visit. She was very tentative to my needs. The other nurse practitioner was not. It was like a joking manner. It wanted me to believe that I was lying and was something wrong with me, when my blood test shows that I have these illness, and you don't have the compassion and consideration of how I feel. If I'm telling you something wrong with me, it is. Just because I walk in that doctor's office that same day don't mean the problem is going to exist. Anybody that has rheumatoid arthritis knows, or arthritis knows, it is not something that is a continuous. It can pop up at any given time. And usually when I do have those flare-ups, it always happens when I'm not at the doctor's visit. I've had a gut week, and then all of a sudden, when I'm not due to a visit for maybe 3 or 4 months or 6 months out, then I have the worst experience at home, because what happens is stress, people, agitation, anything can make you irritated. Bad enough the medicines make you irritated and agitated. And then you have your little crazy family members talk crazy. And then you have the family and friends that want to tell you your diagnosis and tell you what you should do and what you shouldn't do. Fact is that we're all designed differently, and no one can diagnose and tell you what's best for your body. Because all our hormones, we make sure all the same organs, but reality, we are built up different, and our organs function differently daily. So today is a good day. The reason I say it's a good day, even though I'm not in my severe state, but I do have mouth aching today, but I'm able to move around. A lot of times I would always tell you, even on those days that you feel okay and you just might have a little aching pain, still take it easy, because you don't want one little injury or one stress to elevate you to a disaster where it is uncomfortable and you have a major flare-up. And sometimes those flare-ups can last anywhere from 1 day to 10 days or 14 days, depending on your health. That's real talk. But I hadn't talked to you all in a while. I want to touch bases even on my hair growth. Even though I have my hair slicked back, I've mentioned this before about medications. I tried the, baking soda shampoo. Even though I'm saying shampoo, but what it is this: you buy a little 72-cent box of baking soda in a little orange box, and you mix it with water. Some make it watery, but I do not. I use it in paste form. I've only been 3 months ago, my hair had fell out. I had bald spots in the crown area due to medication, due to health complications. But I have found one remedy that they do advertise on YouTube. They always use advertising young ladies or older women with long, luxurious hair, talking about how long their hair grow. But my YouTube video is more sincere because it's targeting people with health conditions, people like me, and that hair breakout that's due to medication and health-related issues. But I've been using this in the bald spots that I have, or hair have actually grown back. So that baking soda is a go. But the difference, what I did something totally different than what those other videos did. I would put the pasty water in my scalp and hair and let it sit for 15 minutes or longer with a bag over and let the heat absorb it. I would do this every time. Now, I've always said, my scalp, it has to be washed 3 times a day. No longer than 3 times a day, or I have sensitive scalp where I can't stand filth. But I did that, and then I rinse it out. Then I use a co-wash by Pantene. That co-wash for dry, damaged hair, it works. It softens your hair. And 3 months ago, my hair was barely a ½ inch. It wasn't even, most of it was smooth, like the back of my finger. I mean, literally smooth in my crown area. It's 3 months later. Even though I wear my hair back and I don't do no more gel, it has actually grown. My hair is wet right now. All over. It comes to about right here. But right now I'm wearing a ponytail, so you really can't tell. But if you follow my videos on health and hair growth on YouTube, you'll see the condition of my hair was 3 months ago. And you'll see the current video 8 showing that my hair has grown. So please stay tuned. Please share, like my videos on YouTube in any video, and give a comment. If you have some health problems or you have a better remedy, let me know. But I will let you know, they did take me off that medicine, knowing, I gotta say this before I go, because that's another topic I touched on. My doctor changed me to a medication, from one medication that made me escalated my eye vision problem, my rheumatoid, not taking consideration of the health risk. And he put me on a medication that I'm pretty much allergic to. So if you don't read them damn bottles yourself, you're gonna be messed up. You have to be proactive about your health. The doctors only know so much what you tell, and they're not gonna always look at those charts and say, oh, you're allergic to this. They're not gonna match the medication. They just going by your diagnosis. So I had broke out with eye patches, purple eye patches. I'm thinking it was my allergies. Then come to find out, I talked to my nurse practitioner. She said, no, that's the side effects of the medication that you're on, that we just recently put you on. No, but I should have went and buy the design every time he sent it in the first time. It'll go to the CVS. CVS say they didn't get it. This went on for 3 or 4 months before I even got the medicine. And all of a sudden, I finally got the medicine. Wasn't on it for barely 2 weeks back in July. And I had that allergy burst, and then my stomach was cramping a lot. I said, well, maybe I'm starting my period, or maybe I'm just ovulating hard, because I have ovulation. I do ovulate, but I ovulate hard. But this medicine right here, I know you can't see it. Now you can. Was a horrible situation again compared to the other one. The other one messed up my vision. I'm going to find out it has aspirin in it. I have always been allergic to aspirin as long as I was a baby. And so if a doctor gives you something with some particles or tell you, don't do it. If you're allergic to it, I don't care if it has a grain of aspirin or whatever you're allergic to, don't do it. Because at the end result, I broke out with rashes, stomach pain, all the side effects, and I hadn't even been on this medicine for 30 days. So they prescribed me another medication that I gotta pick up later, and she's just gonna monitor it because she knows that I have severe allergies to a lot of pain medicines, a lot of antibiotic medicines. So I'm a complex situation. So the new one starts with, it's spelled LEFLUNOMIDA. I mean, L-O is L, let me respell it again. LEFLUM, no, it's, I'm spelling wrong. See how bad my vision is? LEFLUNOMIDE. I don't have my reading glasses. I just have my seeing glasses on. So excuse me for the spelling of the letters. But I believe the name brand or the generic brand is ARAVA, 10 milligrams daily. She wants me to do this and return back to the doctors within a month. If I have an allergy reaction to this, or it does not work for my inflammation, because I had been doing Tylenol 3 just for pain, but it wasn't getting rid of the inflammation, and the doctor didn't want to put me on no hard medicine because you're dealing with kidneys and you're dealing with your bladder. And honey, I'm not trying to go out with no kidney, bladder, none of that, liver problems. I'm not trying to do that. I'm not trying to be on dialysis. So I'm aware that I can control the outcome. But sometimes depression sets in on people so fast where they put their life in the doctor's hand and don't know that they need to put their life in God, themselves, and then the doctor. And hopefully that what God tells them can help them make sure that their body is being nourished and treated properly. And make sure the doctor is on top of your health. Do never let things pass by without getting everything verified. You got to just be more proactive about life. Other than that, I'm going to let you go because that's all I can think of today. I just want to touch bases to my Cushing Disease Angels family out there. Y'all have a great and blessed day.